I think you're much, much faster at adopting innovations. You're more agile, probably taking more risks, but they're calculated risks and all done in a way that's there to really support that whole patient population and that sort of value-based approach. So agility, I think also you're well ahead with us on adopting things like, say, robotic surgery. Obviously, I've got lots of robotic surgery at St. Bartholomew's in the Royal London, but you've been doing that at scale and pace for many years because it's not just good for patients, it's also good for the sorts of healthcare business that you guys, your hospitals operate in. And patients want to look at that and say, what's the sort of advantage to me as a patient? You're very good, I think, at the customer/patient experience because you've got a bit of a competitive edge between some of your hospital configurations in a way that we don't.
Shane, Nashville has a reputation for music, hot chicken, healthcare. Is there anything that's really striking your fancy as you're here visiting with us?
So a couple of things. We did the Country Music Museum, which I'm not a huge country music fan, but that was brilliant. It really was. Just obviously the music, but the history, how it's part of the culture of Nashville and sort of Tennessee more broadly. And then seeing, and I must admit, I didn't realize that Nashville was so important nationally because of the number of healthcare organizations you've got their headquarters here. So that's a huge thing. And that blend of kind of healthcare, music, and the sort of friendly competition about who's adding more to the economy, I thought was quite interesting. And we did go for some hot chicken. I was pretty weak, went for a medium setting, which I still thought was pretty tough. Colleagues went for the sort of double X one. I thought that's just crazy.
Sometimes it is a little bit crazy.